Welcome back, everyone. Hope you had a good break and some good breakout sessions. We have one more panel on the theme of hosted by Region Stockholm. As a step toward the future, a new life science strategy for Stockholm region was established and launched in 2021. And the ambition is to be among the top 5 regions in the world in life sciences. And the next panel will discuss how healthcare innovations are developed to meet the needs of patients and citizens, taking advantage of digital opportunities and new technologies. And this session is straightforward, hands-on, and will focus on 3 concrete healthcare innovations that benefit from digitalization. I will hand over to our moderator, the CEO of Kista Science City, where we are here, those of us who are here physically. Please help me in welcoming Karin Bengtsson and her panel.
Thank you, Beata, and very nice to be here. Welcome to this 30 minutes panel that will showcase Region Stockholm's and how we are utilizing innovations to meet the needs of the healthcare sector of patients and citizens, taking advantage of digital opportunities and new technologies. The theme of today's conference is the human in focus of digitalization. And in these 30 minutes, we will really focus on 3 concrete examples that will drive patient security and healthcare efficiency by the use of digitalization and innovation. I think all 3 projects that we will hear about today are really inspiring projects at the forefront of digitalization and technical development. But they are all also stemming from a drive to increase efficiency and ultimately to save lives. But if we look at these projects from a technical point of view, we will talk about drones, we will talk about 5G, and we will talk about 3D printing. But ultimately, we will highlight and discuss examples of how innovation, digitalization, and also organizational development need to go together to deliver value to patients and to the healthcare sector in Region Stockholm. And with me today, I have 4 esteemed experts, Andreas from the Karolinska Institute, Lena Gordon-Merkes from Karolinska University Hospital, Veronica Vicente from the Ambulance Service in Stockholm, and Fredrik Engströmer from Region Stockholm. I thought we would actually start by all of you introducing the projects that we are here to discuss. And I'd like to start with you, Andreas, to talk about what I think is perhaps the most interesting drone project that we have in Sweden today. So I'll give the floor to you to start.
Very good. Thank you, Karin, and thank you for the opportunity to present our project on drones delivering AEDs in sudden cardiac arrest. Already in 2014, we started this research project from the Center for Resuscitation Science at Karolinska Institutet. Each year, about 6,000 people suffer from cardiac arrest and only 10% survive. We thought we had to do something. We needed to have some kind of novel method in order to reach the patients in their homes at an earlier stage. The drone project started with geographical information system models. In theory, we were calculating based on historical cardiac arrest where to place the drones. We continued with simulations. We tested drones in Norrtälje within the region of Stockholm. We received funding from the Innovation Fund from Region Stockholm, which got us started. And in 2019, we developed a drone for beyond visual line of flight sites, and we actually started delivering AEDs in real life cardiac arrest in June 2021. This is the world unique project. We are the first ones doing it. Still, after 3 years, we're the only ones doing this. And the results from the ongoing project We have 7 drones, 6 in Sweden, and we have 1 in Denmark delivering drones. And we are able to deliver drones in a majority of cases before ambulance arrives, and with the time benefit, which is more than 3 minutes. We have had several patients who were attached with the AD, and 1 patient who has survived. So it's an ongoing research project encompassing all of legislations, technology for an emergency condition where only 10% of all people survive.
Great. So a really good example of how it really saves lives, so it can contribute to that.
Yeah.
I'd like to hand over to Lena to tell us about the 3D Center.
Yes, thank you for inviting me here.
No.
It's a pleasure to be here and to talk about this. Next slide. Well, why do we need a centralized center? Radiology has long been a key in all preoperative planning. We know that. We know about X-ray, we know about CT and MRI, and they are examples of important tools we have today. 3D adds a new dimension, and it's quite difficult to understand why, but it really adds on to diagnosis and planning. Virtual surgery planning and printed patient-specific tools optimize patient outcome. And why is that? It's because what we can do, we can plan in advance on a computer, and we can plan every move and every move of the different parts of the body that we want to operate on. And we can also print tools that we can use in the OR so that we will have a perfect outcome, and this benefits to our patient, and will also save a lot of time for the surgeons. They don't have to do all the planning themselves in advance, so they can focus on the patient, and they can focus on the OR and do more patients, and we can help them plan the surgeries in advance. Next slide. Well, why, who, and how did we do this exploration? We had a 3D project group. It consists of 1 radiologist, a clinical engineer, administration personnel, and we also took help from a law firm. And why do we want to do this? We want to gather knowledge and resources and experience in one place. We want to secure development and education and provide availability for different 3D services.
Great, and you've also brought some interesting
Yes, I brought some interesting things. I just didn't want to start with that. But anyway, this is just an example of what you can do if you want to plan something in advance. You can have a different sort of difficult tumor case in the face, for instance, where you want to plan how to restore the face afterwards. And you can also do a scan. This is a part of the leg that you use the bone to restore a new face, but it's difficult to do that freehand. So we can print tools that you can use to show where you should cut and how to cut it. So it really helps on doing a perfect job for the patient.
Great. We will get back to you with questions, but before that, I'd like to ask Veronica to give us an idea, and we will move into mobile healthcare solutions.
Yes, thank you for inviting me here. And hello, everybody. I'm a little bit sore in my throat, so I hope you can hear me. But I will talk about this project. It's very exciting to talk about this project because the project is coming from the patient's perspective. What is important for the patient's needs. And the thing is that the ambulance service today, we need something to help us to make better, support in the decision making of the patients, how we can treat the patient in the optimal way. And the goal of this project is that the right patient on the right place, on right time, with right resources. And we think with help of MG and video communication, we can solve many problems with this. And if you take the other picture, you can see the picture here. If we use video communications in the ambulance service, you can see there the snow traffic there. It's a scene of injury there. Normally, when the ambulance service, the ambulance personnel come to an injury place, or can be, well, it can be accidents, it can be whatever. They call the dispatch center for say how many resources, how many ambulances this injury place needs for the patient there. And we believe with the help of video communications, the dispatch center at SS Alarm can see the place, and that way they can help the ambulance service to see how many resources they have to send out. Another thing that's very important here too is video communication with precision medicine. We can help if you have a stroke, perhaps, and you are at home and we need help of physicians in the hospital. We can call the physicians, and today we talk with physicians by the phone, but with the help of video communications, we can make a better, how do you say, some build assessment of the patient, so the patient will get the best treatment. And also we can by using video communication, we can also see if we can steer patients. All patients don't need to go by the emergency department. They can also go bypassing the emergency department and go directly to operation or PCI or different treatments, so it gets better. That you don't have to stay in the ED for 8 hours. You can get directly to the help you need. So we believe that maybe this, we hope that this video communication can help for the patient to get the best treatment.
Great. Interesting. And Fredrik, I know you've also been involved in the project that Veronica is running. Would you like to add something on how it came about?
Yes, of course. Actually, we started this many years ago. We started in 2018. And back then, it was all a hype around 5G. It was all about how fast is it? What's the latency? It's very secure technology. The robustness is high. You can use it for navigation services, connect a high amount of sensors and so on. And back then, we looked on cool cases like remote surgery, remote distance monitoring, connected people, and all of that. But then we actually changed focus. Instead of looking at the technology opportunity way of working, we started from the patient needs, exactly as Veronica said.
Yeah.
And we looked at the patient's journey, the patient flow. When a patient or a citizen in Region Stockholm falls ill, it often happens somewhere out in the society. And then they are met by the pre-hospital, by the ambulance services. And what is the process there? How can, what needs do we have there? And how can the technology actually meet up with those needs? And the same thing, using video services, connecting to the remote support from doctors in the acute service and so on. So this was actually a big change for us. And this was something we did back then, and if you wish, a pre-study, gaining insights. And then in 2021, we put the project together. We made the project plans. We got the stakeholders. We got the healthcare personnel involved, looking at the needs and building up the use cases. And end of 2021, we started the project, and actually now sorting the project in 2022, getting the legal aspects there in order, and now we are in the midst of testing. And we will actually end this phase 2 of the project this year and do reporting early next year, and then we'll see how we go into next year, and hopefully then live testing with patients. But that we don't know yet.
Yeah, great. I think all these are very interesting projects of how technical development, and you all start from the patient's needs. But I think there is something else that you have in common, and that is that you've worked a lot with the organization as well. And I'd like to start with you, Andreas. In this project, what have you learned in how you work with the organization, and how has that been an important part of what you have done?
From a healthcare perspective, we see an obvious need. The mortality is 90%. So working together with the industry, in this case the drone operator, and as well with the fire department, the dispatch center, ambulance service, etc., That has been the success factor for actually achieving this. Because, I mean, there are drones available, there are ambulances, there are defibrillators, etc. But putting it all together so that we could have the permits in order to actually be able to fly, that's been the kind of the key factor to working together.
And in the 3D center, Lena, how is the organizational part of that important?
Well, it's important to make the administrators and the hospital to understand what this means and what we can do, and how important it is to take time off surgeons and to help them understand patient illnesses better and to understand deformities in a better way. So it's really, that's the key, is to make them understand it, and to make them understand that going forward costs a bit of money in the beginning. You really need to put in some money and energy and personnel to really go forward. Otherwise, it will keep you back.
Another key aspect, I think, is the legal part. And I know you've all been working and maybe also struggling sometimes with understanding the legalities of the projects that you are working on. Veronica, how do you think that projects like what you have been doing is important in understanding the legal framework, and perhaps also sometimes pushing it or understanding the policy frameworks?
Yeah, that's a very good question, because it's very difficult, the legal thing. It's taking almost 8 months just looking at the legal stuff. Yeah, and the thing is that it's very important because it's about the patient's integrity and the person's integrity, and we have to have full respect of people's integrity. So that if we're sending video communications, everybody can see that the people that are looking at this video and the personal. So the legal is very important to see, and I think we have come to a place now that we more and more knowledge about this, but we are not yet ready. So we are looking at the GDPR now. How do you say GDPR?
Yeah.
GDPR.
Yeah. So, but we are hopeful.
Yeah.
Yeah.
And I think understanding you need this kind of projects to also understand what the issues are and to drive it forward. Fredrik, from your perspective, how are these examples good examples of how Region Stockholm is working with innovation?
I think they are terrific, fantastic examples, and I think the three persons that you see here, I'm very proud to be on the same stage as you, because you are really the ones that have been driving this forward, and we need this extra energy that you have. I think Region Stockholm as such, as you know, we are some 46,000 people, and we provide healthcare services to our 2.2 million inhabitants. We also provide transportation services, engage in cultural activities, and also regional growth. In here, we have some 50 innovation leaders dispersed over some 16 different local innovation offices. Now, these local innovation offices, of course, engaged quite a bit in local innovation projects, but then we also work together in these regional innovation projects, like you see here, like the 3D project that was started many years ago, as Lena said. And from innovation perspective, we were involved in this 2015 already with a 3D printer, working together all across Region Stockholm. With the drones, we are right now doing a pre-study on medical deliveries on drones, following what Andreas has done and continuing on that. And the 5G project, that's a perfect example of several organizations working operational together, but also the other units in Region Stockholm learning from this, and we're sharing this internally. So I think that all of this is very good examples of how we work regionally. And that's something that we have really increased in doing over the past couple of years, I would say, as well. And we intend to continue to do that as well.
Great. Before we open up, I think, for some questions from the audience, I'd like to ask you, Lena, why do you think it's important that the Region Stockholm is continuing to invest in this kind of projects? Because it is an investment, and all of these are innovation projects, so you don't really have the answers from the beginning, but it's about learning. How is that important?
I think it's very important because this is a difficult field. You have to it's a long, steep learning curve. It really takes time to learn this, and so you have to help each other. You have to be together. You have to help. We also get help from Europe, from other cities, from the States, to see how people do it today. So it's really important that you get together and you help each other out, because if everybody works in their own office in all departments, you're never going to go forward. We have to help each other. So it's very important to have now we have a 3D center at Karolinska Hospital. I'm very proud of it. We started in the 1st of September, and we really have the core. So now we can start sort of expanding and
building from that.
Yeah.
And Andreas, from your perspective, why is it important to have this kind of innovation projects that are at the forefront?
Because I think we can't be satisfied with what we're having today. There are as well other conditions which might benefit from the technology. Some of those are unknown to us at this stage, and they evolve as time goes by. So kind of not being satisfied with the current situation is the kind of grow ground here.
And I think we talked a little bit about that. Is it the need of the patients or the technology? What is the push and pull factors? But sometimes we don't know that, and we have to explore both options, I guess, as well. Veronica, from your perspective, why is it important?
The patient. For me, this patient is the surviving, is the having the best care they can have and optimal treatment. So I think the innovation can make it possible. So as you said, it's very about coming together, work with this, and have ideas and work with these ideas to make it better. Because when we need help, we need help. Yeah.
Great. I think before we continue, I think, Beata, might there be some questions from the audience, both online and here in the room?
Yes, there are. There's a question on scaling. If you could talk briefly about what are the biggest challenges to scaling the different solutions or projects that you described. I don't know who wants to start. If you want to go first, Fredrik.
Well, I can start. I think that to scale, there are numerous ways of doing it. Either you can scale inside of Region Stockholm, and then you need to have the needs owner that really wants to drive this forward, like Andreas or Lena in this case, and then you build it from there and you spread it from there. And you need to have the funding, you need to develop it, and so on. The other way is, of course,
a proof of concept with a clear needs owner in the organization first.
Exactly.
Okay.
The other way is of course commercialization that some are doing as well. So I see that there are two different ways that you could do it.
What would you say, Lena, about your 3D solutions? Are they exportable to other regions in Sweden, to other hospitals globally?
We have a small problem there. There's legalities. We have these EU laws we have to comply with. The MDR, medical device regulations, they came last year in May. And we have, as long as we go by them and do our flows, and I'm sure we can. I'm not sure we can today export to other regions, but we will probably find a way, because everyone in the whole Europe has this problem. In the States, they don't really have this problem because they don't have a law now, but they will probably get one.
And for scaling for the needs within just the Karolinska ecosystem, are you doing enough? Is there more demand?
Oh, there are much more demand.
Yeah. So it's a question of funding, or?
It's a question of depends on how you see it. You have to educate people. So we need more personnel, more staff, and of course it's funding. But there's a big need, yes.
Andreas, do you have a scaling challenge with your solution?
There are so many opportunities with the kind of system we're working with. In this research project, we have problems with funding, as of course, of nice, kind of expensive technology. Within healthcare, there's a need for evidence-based medicine. We need to have proof that it's really having an effect, so that we can use it and put it into clinical care, so to speak. But about scaling, looking at drones, everyone's looking at drones for commercialization. and that's from a aviation safety aspect. So if we are able to show that we can do this procedure in a safe way, there's a whole branch of opportunities for deliveries of anything.
Okay. Can I ask some more questions? It's a question about speeding up learning. You were the one who introduced, Lena, the real need here for new kinds of insights, or capabilities and skills, and what kind of learning and how do we speed it up? What kind of skills and capabilities are you in need of? I mean, we are talking about patients too. We can't learn too quickly to harm patients.
No, but you need a basic education in physics, in technology, or we have a clinical engineer for now. But you need to have some basic education, of course. But in Sweden, we don't have an education for 3D. Then I have to tell you how you do this. Briefly, what you have, if you have a CT scan and you want to print this spine, for instance, you need to segment it, and you need to tell the computer what parts I want.
Can you do that?
Yes.
You can do it. Mm?
Yeah.
You've done that.
I've done that.
Okay.
Yes. And we do a pediatric heart or a crashed knee. And everything is you have to tell the computer what to do. And when you do a virtual surgery planning, you have to plan with the surgeon, and that's really very hard work to learn how to do that. So you have to know a lot of computers and programming and programs and how to do this, and it takes skill. So it takes time to learn. And
the next generation that are studying medicine now, are these skills that they acquire during their
no, not really.
Basic education?
In Europe, there are special programs for this 3D segmenting and 3D work.
Veronica, what other kind of learnings are important? What other kinds of skills are important going forward? You don't, because you're also working cross-functionally.
Yeah.
With other people than you used to work with? What would you say is important here?
The patient has one tillfälle, what do you say that?
Okay.
Opportunity?
Well, no, one occasion.
Yeah.
When you get sick, you call 112, and they send out an ambulance. But the thing is, the patient transport through different healthcare providers. And when the ambulance service or the dispatch center, they have their knowledge how they treat, how they can inform the patients for the needs, and then the ambulance service has it, and then the hospital, and then so on.
So the knowledge is stuck in silos in a way.
Yeah, so we have to start to see the patient's journey through the healthcare system.
And that's a way of learning.
That is a way of learning. It's a very important way to learning, because we have resources in Sweden for helping people, patients, but we have to effectivisera.
Make it more efficient.
Yeah, then we have it today.
There's another question here, if you dare to or want to answer it. Do you know of any digital innovation in this domain that has failed? And how do you plan to mitigate risks and avoid reproducing the same errors? Biases on data, exclusion of minorities, outliers, and wrong diagnosis. Who wants to go?
Well, I think it's important that we, before we start any study, of course, we do an analysis of what has been done around globally, in Sweden, and so forth. We are in close contact with our other sister organizations in the other regions, like in VGR, Skåne, Uppsala, and so forth, to learn from what they have done, and we share experiences between ourselves. So before we engage in any project, we of course look to what has been done before, and also on a global level. And also to add to your previous question about, I think that we need to engage in this triple helix model. That is super important. Academia, public sector, and the private sector, all in all. And while doing so, we also need to be multidisciplinary.
Yeah.
So an engineer, like myself, moving in the healthcare sector, or healthcare personnel moving into technology.
And you need dual perspectives, triple perspectives.
We need to do that, and you need to be able to change your mind and come out of a different, going from technology push to patient needs. That is a mental journey that you need to be able to understand and actually cope what it means concretely.
But if I ask the question, rephrase it like this: when innovation is not successful, what is usually the factor or the reason for it not to fly?
Isn't that also what we do this kind of projects for, to actually learn, and that it doesn't have to be a failure, but it is actually a project. All of these are projects that are sort of a little bit cut out from the ordinary business of the hospital, so that you can actually innovate and learn in these projects. It doesn't have to be a failure if it's a learning process.
Most of these things, for 3D, for instance, has been done for a long time, and it's been done all over the world. So it's really, you know that it's not going to be a failure. It's really impossible.
There's so many more questions, but unfortunately we are running out of time. The questions about printing, 3D printing soft tissues, about innovation, and I just have to stop here. Your panel was great. Thank you so much for joining us today and contributing.
Thank you.
Yeah,